Hello, everyone. It's another Wednesday with your fertility specialist. On behalf of Alps Hospitals, I love to say a very big thank you to our dear viewers. Thank you for liking our posts. Thank you for staying tuned. Thank you for always staying glued to your screen. I'm excited always to be your host, Ruth Ogogo. And today we're talking about fibroid and fertility. Okay, so our poster shows that we have Dr. Jane, but then duty calls. So we have Dr. Deborah, and would have her take us today on fibroid and fertility. We sincerely apologize for those of us that were looking forward to see Dr. Jane, but trust me, I'm sure you're not missing anything because Dr. Debbie would deliver as much as Dr. Jane would deliver. Dear viewers, as we get started, feel free to drop your thoughts, your comments, your questions in the comment section, and we'll definitely attend to them appropriately. For someone watching for the first time, it might interest you to know that our guest, Dr. Deborah Olubi, is a family physician. She's a fertility specialist. She's an IVF specialist. She's also the head of IVF. That's more like saying the IVF coordinator of Alps Hospitals. Wow, Dr. Deborah, it's good to have you with us today. You're
Thank you,
welcome.
Ruth. Always a pleasure to be here. Good afternoon, viewers.
So, dear viewers, please, there's a lot about fibroid and fertility that Dr. Debbie would enlighten us about today. So, please, once again, call up someone, share this link with someone. Fibroid is something that seems to be very, very common in the world, and then in Africa and even Nigeria,
Yeah.
it doesn't wait for any age. As we get into this talk, of a lot of statistics have shown that even young people could actually have fibroid. So this is not just a topic for old people. So even if you're young, do not feel that this topic does not concern you. I know young people that have had fibroid surgery, so you're not exempted from this talk this afternoon. Once again, welcome, dear viewers. Have a lovely time with us. Dr. Deborah,
Yeah.
so we're talking about fibroid and fertility.
Yeah.
Was maybe I don't know if there are people in this world that have not heard about fibroid. But then, you never assume that everybody
Everybody
knows.
knows.
Yeah, you never
Yes. Yes.
assume that everyone knows. So what exactly is fibroid? When we talk about fibroid, what are we referring to?
Okay. So uterine fibroids. So in this sense, we're talking about uterine fibroids. So they are abnormal growths in the uterus.
Hmm.
Yes, so they are like benign tumors. When you say
Okay.
tumor, a tumor is like an abnormal growth. But when we say they
Hmm.
are benign, that means they are not cancerous. They are
Okay.
not cancer. They cannot spread to another part of the body, to another organ.
Hmm.
Yes, so they are not life threatening in a sense of being able to metastasize to another part
Okay.
of the body. But they can definitely cause a lot of issues,
Hmm.
especially if they are multiple and they are very large in size.
Hmm.
And like you rightly said, no woman is exempt. Any woman in the reproductive age group is at risk of having uterine fibroids.
Fibroids.
Yes.
Wow. Okay, so I have a question saying that, can I have fibroid and not know that I have it? Is it possible for someone to have fibroid and not know that they have it?
Yes,
So it means
yes.
that there are times people can have fibroid and they
Do
don't
not
show
know. Yes.
symptoms.
When
Oh wow.
exactly some fibroids can be asymptomatic, no symptoms, especially when they are very small. What we would say
Hmm.
maybe seedling fibroids,
Oh,
very
okay.
small and very
Hmm.
few.
Hmm.
Yes. So that kind of fibroids, and then depending on the location of the fibroids, might not show any symptoms. You might just be doing a scan for another reason, and then
Hmm.
you
Then
just
you
notice
see.
that, oh, madam, you have some fibroids developing.
Hmm.
Yes. So you can have fibroids and not know that you
Wow.
have fibroids. Yes.
Okay, okay. So this brings us to saying, are there some symptoms that people could have that makes them know that it's likely you're dealing with fibroid? Yeah, or what are the possible symptoms that people could experience when
Okay.
they have fibroid? So things that they should look out for,
Okay.
giving them a pointer. There's fibroid. Yeah.
Yes. Okay. So, um so this before we talk about the symptoms, fibroids can be located in different parts of the uterus.
Okay.
The ones that are majorly symptomatic are the ones
Mm.
located in the lining of the uterus, what we call the
Okay.
endometrium. So what we
Mm.
call submucous fibroids.
Oh
Yes,
wow.
those kind
Mm.
of fibroids can lead to heavy and prolonged menstrual bleeding.
Okay.
Yes, so
Mm.
you see a woman bleeding, that fainting and passing out.
Wow.
Yes, some people might need to have supplements to help replenish to transfusions. Or bleeding can be coming out
Mm.
with clot, any of, yes, yes, that the bleeding can be that bad and for longer than that. Give that. You could also have fibroids in the muscle part, femoral fibroids, and these kind
Okay.
of fibroids, if they're especially large, big and multiple, some of them
Yeah.
can be just directly under the lining of the womb, so
Hmm.
distorting the anatomy
Oh, oh,
of that
wow.
lining. So those
Wow.
ones too can give you very heavy bleeding,
Bleeding.
even pain. Yes,
Hmm.
can give you pain. So that's another presentation. You can have pelvic pain.
Wow.
Sometimes because these fibroids are very large, they could be compressing of nerves in your
Hmm.
pelvic region. So that could add to the pain.
Wow.
Yes. So you could have heavy bleeding, you can have prolonged bleeding, pelvic pain.
Hmm.
Then you could have symptoms that arise as a result of pressure
Hmm.
of these fibroids on other organs around the
Organs.
uterus. So, like your
Hmm.
bladder, if the fibroids is huge, compressing on the bladder, you could have frequent, urinations. You could even have
Yeah.
urinary retention,
Hmm.
difficulty in passing urine because it's
Wow.
totally, obstructs the urethra,
Hmm.
so that the urine can't come out. So
Wow.
that's a major symptom. Could even compress on the rectum, giving
Hmm.
you constipation. Yeah, so
Wow.
those are some of the major symptoms you could have from
Have. Wow.
fibroids that are symptomatic.
Okay, so for someone watching, Dr. Debbie has made us to see some of the symptoms. So the fact that you have heavy period, don't just assume that it's normal for you to have heavy period.
Yeah.
It means that if you're having excessive, when do you say a period is heavy? Like how many pads should the person use for them to know my period is
Yeah,
heavy?
so when you almost have to be changing almost every 2 hours, you're using
Wow.
multiple pads. Some people
Hmm.
even have to just sit on the toilet seat
Hmm.
because that's how heavy, or you're
Bleed.
feeling
Oh my
faint, you're
goodness.
fainting, you're even collapsing. That
Wow.
kind of period is
Hmm.
heavy,
So
yes.
it means if you are using up to 5, 6 pad a
Pads in a
day,
day,
is
yes,
worrisome. I think
yes.
ideal 2 to 3 should be fair enough for
two
a
to
day, right?
three, yes, at
So,
most four.
so
But by the
if
time you're going to five, six, and
six,
more, that period
that's
is really heavy.
worrisome. Yes, that's worrisome. So let's take note from this point of about the symptoms. You might be experiencing some of this and you might just assume it's normal, or that's how my mother's period is,
Yes,
so that's how it's supposed to be for me. Check yourself and be sure that they tell you everything is fine, and don't
fine. Yeah,
assume
better
that
you
that's
check
how it is
yourself.
for your mom, or that's how it is for your sister. That's what you're experiencing. Be sure there's no fibroid. Okay, so are there some things that stand as or pose as risk factors? Are there people
Okay.
that are predisposed to fibroid,
Fibroids,
or
yes.
is there a particular cause of fibroid? Is there something or a lifestyle someone can maintain that puts them at risk of fibroid?
Okay, so the cause of fibroids is not really known, but
Mm,
there are things that have been associated with it, or like you
okay.
said, some people that are more predisposed. So the black race commonly were at the
Oh
risk of
wow.
having fibroids.
Wow.
The cause has been related to genetics, and one of
Mm.
it is the black race.
Oh
Yes, if you're
wow.
of the black ancestry, you are more predisposed to having uterine
Wow.
fibroids. So we
Mm.
see it a lot in our environment. Yeah, a lot of fibroids. We see a lot of fibroids.
Okay.
Also, if you have a family history, so maybe your mother or sister had fibroids, you are also
Mm.
at risk
Of
of having
having
fibroids. Then
fibroid
people that
too.
are obese, there's been a link that people that are obese also have a higher risk, of
Wow.
having fibroids.
Fibroid.
Yes. So,
Hmm.
like you mentioned, some lifestyles could predispose to you having uterine fibroids. And then,
Okay.
if, especially if you're obese, so someone
Mm-hmm.
that is obese, you know that that person mostly has a sedentary lifestyle.
Hmm.
The diet, person is not eating healthy. Maybe
Yeah.
diet consists of a lot of carbohydrates, a lot of fats and oil,
Hmm.
you know,
Wow.
that leads to the excess body weight. So that kind of person is predisposed. And also people that start menstruation early,
Hmm.
because yes, what has been linked to the cause of fibroids is prolonged exposure to estrogen. And
Estrogen.
estrogen is
Okay.
something that you have in the normal menstrual cycle. So a
Hmm.
girl that starts menses early, she's exposed to estrogen for a more prolonged period than someone
Period.
that starts later. Maybe
Hmm.
someone that starts menses at the age of 14, 15, as opposed to someone that starts before the age of 11. So
Hmm.
that one, the person that starts earlier has more years of exposure to estrogen. So that has been linked in the causation of fibroids,
Hmm.
estrogen. So
Wow.
a person that has an early menarche is also at risk of
So that
having.
means fibroid is common with women of childbearing age, or
Yes, that's
for
why I said
anybody.
women, no
Oh,
woman is
wow.
exempt if you're in the
Hmm.
reproductive age group.
Hmm.
Once you started having
Seeing
your
your
periods,
period, you're at
yes,
risk.
you're at risk of having
Oh,
fibroids.
wow.
Yes,
Wow.
because the same hormone, estrogen,
Hmm.
that is involved in the menstrual cycle is what is thought to lead to the abnormal growth of the uterine tissue into these masses and tumors we have.
Wow. Okay, so I know you as a fertility specialist, I know you've had a lot of encounter, you've seen a lot of patients or clients that
Yeah.
have come down with fibroid. What's your assessment before we get to the impact of fibroid and fertility? What's usually your counsel to someone that's trying to achieve pregnancy
Yeah.
and they have fibroids, or they are dealing with fibroids and they're trying to achieve pregnancy?
Okay, so we all know that fibroids could impact pregnancy, on
Hmm.
fertility, could impact on
Yeah.
fertility and even on pregnancy outcomes.
Hmm.
But the extent of the impact, you might not really be able to tell. It could differ from individual to individual. But as a general thing, we know that fibroids can impact fertility and pregnancy.
Yeah.
So once we scan a woman and you see fibroids, really if they are large,
Yeah.
multiple, and then
Hmm.
depending on the sites, if you have submucous fibroids, intramural fibroids that are close to the endometrium, any
Hmm.
fibroid greater than 4 by 4 centimeters,
Yeah.
you want to counsel that woman that the fibroids should be removed,
Hmm.
because as we'll go on later, we'll see that fibroids can actually impact on achieving pregnancy, achieving conception, and even the outcome of the pregnancy.
Okay, so let me now. So we're talking about fibroid and fertility. So
Yes.
what's the impact? Because you hear a lot of women saying that I have a friend, she got pregnant, she gave birth,
But
and she
with
has
fibroids,
fibroid, and
exactly.
then
That's why
sometimes they now wonder, is really fibroid? Is it enough for me
we
not
to
to get
do
pregnant, or and all
exactly.
of that?
Yeah,
So what's
yes.
really the impact of fibroid on fertility?
Okay, so
Yeah.
fibroids can have a lot of impact on fertility.
Okay.
One, it could prevent a woman from even getting pregnant,
Hmm.
especially when you have submucous fibroids, fibroids
Wow.
growing into the lining of the womb.
Hmm.
Yes, can prevent an embryo from implanting. So pregnancy does
Wow.
not even happen.
Hmm.
Yes, fibroids change the atmosphere, the hormonal atmosphere of the endometrium, and it doesn't favor implantation.
Hmm.
And then even when a woman gets pregnant, depending on the size of the fibroid, it could prevent the baby from developing as the baby should, could cause
Hmm.
fetal growth
Good
restrictions for the
vibration.
baby, because
Hmm.
fibroid is occupying so much space that the baby is supposed
Yeah.
to
Hmm.
occupy.
So they are contending. More
Yes,
like.
exactly.
Hmm.
They're contending, with the baby for space that's
Yeah.
available. Then
Hmm.
fibroids, if they are located, some fibroids could even be located along the breast canal where the baby is supposed to come out first.
Wow.
So that could obstruct a woman from having a vaginal
Vaginal
delivery. Yes, if the
delivery.
fibroid is obstructing that birth
Hmm.
passage, the
Yeah.
woman can't have vaginal delivery. And if there are multiple fibroids, because the fibroids tend to take blood supply away from the normal uterine tissue,
Hmm.
so it could cause a lot of you know problems with even the lining. Can reduce blood
Wow.
flow to the lining, that
Hmm.
getting pregnant is a problem. And then fibroids could undergo changes in pregnancy, like red degeneration, giving the woman a lot of pain.
Hmm. Wow.
Yeah, and the fibroid tissue are usually abnormally contractile, so it could lead to preterm contractions, even miscarriages. So miscarriages are quite common
Come on.
in
Wow.
women with fibroids,
Hmm.
who are pregnant. So that's another common thing that they present with miscarriages. So fibroids could lead to
Concerning
miscarriages.
miscarriages, because
Yes.
I know of someone that's had recurrent miscarriage and they've counseled her
Hmm.
up to have a surgery, and then she keeps saying no, she wants to try, she's scared of having the surgery.
Surgery. Yeah,
So
lots
and
of
then she
people
has
are.
had at the end of the day, by the time she had the last miscarriage, she consented to saying okay, she would have
Have
a
the
surgery.
surgery.
And I mean, she has had to deal with like 3 miscarriages.
Miscarriages.
That's
Oh.
really a sad one. And then it's the
Yes.
same thing they keep telling her: the fibroids will not allow this baby
Yes,
thrive well,
especially depending
and all
on
that.
if they are large, multiple,
Mm.
it's better the fibroids, come
And
out.
I think in this part of the world, a lot of people are scared of having. When in fact, first of all, when they hear of fibroid, they're worried. Like, okay, fibroid, and then they start rejecting and binding and
Binding.
casting all the demons and all.
Yeah.
And then that by the time you now get to the point of, okay, we think you should have a surgery and all. So maybe we should come to this point. Maybe you should tell us a little about what's the what treatment is available for treatment of fibroid,
Fibroids.
because a
Okay.
lot of people take concussions to say to shrink, or
The
they'll say
fibroid, yeah, herbal
they
treatment. I've heard of
and
them
all of
all
the,
sorts.
yes. So
Yeah.
yes, so what are the treatments available, what are the treatment options
Yeah.
available for
Okay, so
treatment of
for
fibroid?
fibroids, the definitive treatment is surgery. A
Okay.
fibroid surgery, what we call myomectomy, to remove the fibroid.
Mm.
But there are also medical treatments that can be done. Most of the
Okay.
medical treatment are just to manage the symptoms. Maybe a woman having heavy periods,
Mm.
painful periods. Periods are prolonged, painful. So we give drugs that can help to reduce the bleeding. For
Okay.
example, you can have an IUD that has a progesterone that
Okay.
can reduce the bleeding. So the
Oh
bleeding is not
wow.
heavy.
Mm.
There are some drugs we can give, gonadotrophin receptor agonist,
Okay.
that will prevent the body from producing estrogen and
Okay.
progesterone.
Mm.
So in summary, the woman won't be menstruating.
Mm.
And we
Okay.
talked about estrogen's part in
Mm.
causing fibroids to grow. So
Mm.
you block that, there's no estrogen, there's no progesterone.
Okay.
So that helps to shrink the fibroids, that helps to relieve the symptoms that the woman is having.
Okay.
So, and then a woman is anemic, you give hematinics
Mm.
increase the blood level, or you even give blood sometimes. So most of the medical management are just to relieve, they are just temporary measures to relieve the symptoms of the
Mm.
fibroids. They do not take away the fibroids. So surgery is the definitive thing. There are
Mm.
other micro-invasive procedures that can be done. You could
Okay.
have a uterine artery embolization, where you direct a dye to block the blood vessel to the
Oh
fibroids with
wow.
a way to reduce, to stop blood supply, oxygen
Okay.
supply to
Mm.
that
Mm.
fibroid, so that
Yeah.
it stops growing and then
Oh
can
wow.
shrink. Yes.
Oh
You
wow.
can even use ultrasound to try
Mm.
to to destroy, to break down the fibroids. But these
Okay.
things, sometimes they don't totally remove all the fibroids. So
Mm.
the only definitive thing that removes all the fibroids is surgery.
Okay.
Yes,
So
myomectomy,
okay.
fibroid
So
surgery.
is it all the time that you counsel them to have open surgery, or there are other modalities of surgeries that could also take out
Yes. So the other
fibroids?
modalities of surgery are the ones I mentioned, using high frequency ultrasound to
Okay.
try to break down and destroy the fibroids, and the woman passes out the pieces, but it
Okay.
doesn't remove everything.
Mm.
Or trying to direct a contrast to block the blood vessels supplying the fibroids.
Okay.
But if the fibroids are multiple, how many of the blood vessels can you actually, let's say it was a very just one large one, you could try that.
Mm.
So they don't achieve as much, the results you really want, as much as the fibroid surgery that is able to completely remove the fibroids.
Okay. So
Yes.
there was this day that I got a call from somebody, and she was saying that she didn't want to have an open
Okay.
surgery. That she was told that she could have hysteroscopy
Yes.
to
Okay.
to
That's
to
true.
take out a
If it's a
myomectomy.
submucous
Yes,
fibroid,
so I
hysteroscopy
was
can be used to
wondering
take
that
it
there are
out.
times, yes, that you at our hospital would
Yes, a lot
recommend
of times. Yes,
hysteroscopy.
that's one of the benefits or advantages of hysteroscopy. One of the things we can achieve with hysteroscopy. So if the
Mm.
fibroids are submucous, they can be taken out at hysteroscopy.
Oh
But if they are
wow.
in the muscle or maybe subserous, okay, that's another kind of fibroid. A fibroid that grows outside the
Okay.
uterus into the abdominal cavity, in the
Oh.
peritoneal cavity, a
Mm.
subserous kind of fibroid. Those ones you have to go into the abdomen to remove them. But if
Wow.
it's submucous, hysteroscopy can take that out. And
And
if
I
it's
know.
intracavitary, a
Mm.
fibroid that has a stalk in the muscle, then growing into the endometrium, into the uterine cavity. So a hysteroscopy can also remove that.
And I know that in Alps Hospital you could do this laser surgery a
Yes, we
lot.
do a lot.
So
We do that a
are
lot.
there times that you could just use your laser to devitalize the fibroid in
Yes,
the
and then
course
it
of?
now falls out
Oh
later.
wow,
Yes,
okay.
definitely.
Oh
Yes, we
wow,
do
wow.
that.
There's a lot that this laser obviously
Laser
can do.
hysteroscopy can achieve.
Mm.
Yes. So that
Wow.
we're able to achieve that with it.
Okay, so and you know that a lot. I'm sure people watching, the way you would sound, you make fiber surgery look very easy, and then they are like, I have a friend of mine. They have to remove her womb after fibroid surgery. So it
Yeah.
makes us wonder: are there complications associated with
Definitely,
fibroid
with any
surgeries?
surgery, there are complications.
Mm,
There are complications with any surgery.
okay.
Complications, infection, maybe bleeding,
Mm,
and all that. But if they're done by
yeah.
experts, and you do all the pre-op preparations, patients adequately prepared, complications are at a very low, minimal. The complications are minimal. Sometimes if a woman has completed her family size, she has had all her children, and these fibroids keep, because fibroids can reoccur, they can regrow.
Oh
Yes,
wow.
yes. So the fact that you've had a fibroid surgery doesn't mean
Surgery.
the fibroids can reoccur. That's
Mm,
why people that are trying to conceive, we advise and counsel that you try to conceive as
as
quickly
quick as
possible
possible.
after you've had your fibroid surgery. Like we said, it's due to the estrogen, and the woman keeps being
Mm,
exposed to that estrogen
okay.
unless you are now menopausal. You get to menopause. So yes, complications are minimal when they are done by the experts, people that are well trained to do it.
Mm. Okay, so dear viewers, there's a lot about fibroid and fertility. Dr. Debbie has given us very, very deep insight into what um, fibroids could do. And she has also made us to know that people that are scared of having a fibroid surgery, trust your fertility specialist.
Yeah.
And it's something else to note because I know she's a fertility specialist, and I know that they'll pay deep cognizance to the vital part of the uterus, which you
Yes.
call the, is it the inner, and
Yes, the
okay,
endometrium.
because it's another thing. You might go to somewhere where you might be malhandled, and then they temper with this
Which, yeah, that's
lining.
true.
So if you even if you're going to have a fibroid surgery, it should be somewhere that would take care of every part of you with the prospect of
That have
having
your future
fertility in view.
fertility,
Oh,
yeah, prospects are hard, because some people could have a fibroid surgery and then the endometrium is totally devitalized, destroyed,
mm,
and the woman needs that endo. That's where implantation takes place. Yeah,
yeah.
so you should do it where people know that, oh, we're doing this fibroid surgery towards an end, not just to remove the fibroid. This woman hopes to get pregnant, hopes to carry her babies in this
Yeah.
same womb, so that care is taken to make sure that that endometrium is not compromised. There are a lot of things we do in our facility to
Mm.
make sure that the endometrium is not compromised after a fibroid surgery.
As a matter of fact, I've heard of someone that after she had a fibroid surgery, still in a young age, she from the fibroid surgery, she was no longer seeing her period.
Period. So that
And
means the endometrium was totally tampered with,
mm,
and maybe she
wow.
developed intrauterine synechia, adhesions there, and she's no longer bleeding.
So so maybe we might have a professional watching. What would be your counsel to them with regards to doing their surgeries and how they should manage their
Okay,
patients?
so they should just be careful not to breach the endometrium. And when endometrium is breached, there are things you can do to try
To
to still salvage it and conserve it. Yeah,
mm,
sometimes you might need to pass a catheter, leave a catheter in
in
the
the
cavity. There's a substance we can also inject to
mm,
try to maintain the integrity of that
of the
space so that it
uterus.
doesn't close up together. So
Wow.
a lot of things that could be done. Yes.
So if we have professionals watching, make sure that you have your various clients' fertility life
Like
in view.
view,
So you
exactly.
don't they don't have a
Why
surgery and
that's
it
supposed
feels
to
like,
improve their
yeah,
fertility concept,
and
and that
then it
surgery
feels
just
like you have put
just
an end
end,
to
exactly,
their
just ends it,
fertility dreams. I
ended it.
mean,
Yes.
so do you have viewers you're watching this right now? If you've been diagnosed with fibroid, please get a good place like Alps hospitals. For some people that will be able to access Alps hospitals, you could please seek proper attention and go
Mm,
to where thorough examination could be done. And like she had mentioned to us, not all fibroids need to be
it's
open
open.
surgery. There are
Yes.
some that could be done other means, but then do not go to where they give you false news that it could be done without a surgery, and by the end of the day they realize you still need open surgery.
Surgery. Yeah.
And then sometimes I know that your fertility specialist could counsel you that, okay, we would try to see if we would want to take out this fibroid through hysteroscopy, for instance.
Mm.
And then by the time they get into theater, they realize it's much more than what
What
the
hysteroscopy
hysteroscopy
can
could do.
do?
So do
Yes.
not feel at that point that they just wanted to use you as an experiment. At that point, you should know that they
Have your
nobody just
best,
wants to intentionally
yeah,
want
they
to
have your
open you
best
up.
interest at heart.
Exactly.
Yes.
So at that point, they are trying to, as much as possible, minimize injury to you. But now when they see the need, you should also trust them to do what is right, and know that they're also concerned about your fertility life and what will give you prospects,
Yeah.
and not what you do and you are still back to where you were,
Yeah,
and then it's
started
more
from
like,
no.
yes, no solution was preferred. So trust your good fertility. I have to mention good one at that, to give
Yeah.
you the right
Just
counsel.
go to the
Yes.
right
And
fertility specialist,
exactly, and
right
then to
gynecologist.
give you
Yeah.
the right treatment for this. And then for those of us that believe that you could take concussion, and she has already debunked that.
Mm.
Yes, we don't know the various operations out there. Everybody has what their concussion and how they defend it.
That has
But
caused more damage.
yes, because
Gynetrasia and so on. There was someone that was
mm,
inserting something to a vagina
are you serious?
to cause the fibroids to
Oh
melt,
my
like you said, and
goodness.
so they will drop. Just
Wow.
destroyed the whole vagina, the cervix,
No.
everything is gummed together.
Hmm. Wow,
So she
that's
was
really a
worse
sorry
off than
case.
she started off.
Wow.
Yeah.
So you see, dear viewers, yes, a lot of cancer coming, and fibroid is something that a lot of women, especially Nigerian
Black
women,
women are dealing with,
African,
yeah.
blacks, yes, they dread so much. But when you find yourself having it, it's not a death sentence. I mean, there are times that you see people carrying fibroid and you think they are pregnant.
It's a lot. That's
Wow,
another of
can
the symptoms.
imagine.
Feeling of fullness.
Hmm.
The tummy is big. You think it's pregnancy, but it's a fibroid.
Wow. And people will be telling you congratulations, and
Hmm.
but then they are wondering, you are
Yeah,
not
are you
giving
bet?
birth. Time never reach.
Those
Time never
pregnancies.
reach.
You know
Oh
those
my
pregnancies that
goodness.
women say they carry for 1 year, 2 years. A lot of it is
Mm.
fibroids.
Oh my goodness. And people will be like, madam, time never
Preg-
reach to bone, and then they don't know it's fibroids
yeah,
that they are carrying. So you don't just you don't have to wait till it gets to that point where it's so big.
big,
And
exactly.
then it's now,
Compromising your quality of
yeah,
life.
and then it even makes the
Yes,
surgery really difficult when it
exactly.
gets
More,
that massive and
yeah, and that's,
complicated.
yes, increases the risk of complications at that stage. Yeah, that's true.
Okay, so dear viewers, you see that there's just a lot. So all we are saying is, you don't shy away from it. When find solution to it by getting to a good fertility specialist, a good gynecologist, and a fertility specialist at that, so they are able to give you the best of care, as well as preserve your fertility
Yeah,
perspective
yeah.
going forward.
Forward.
That's after your whole care and treatment have been preferred. Okay, so as we round up on this chat today, Dr. Debbie,
Yeah.
what's your counsel to people dealing with fibroid people? Because I know there are people that have had surgeries, even one, two times, and
Multiple.
pregnancy.
Yeah.
Yes, what's your counsel to the general populace or to our dear viewers with regards to fibroid and fertility in general?
Like you
Mm,
said, using the fibroid, your future prospects must be preserved.
mm,
You won't say you need fibroid and cause other problems that will make you achieving your fertility difficult. So go to a ensure you see the right people, the experts, qualified people, fertility specialists with adequate experience, and education. So they are totally assessed, and then they will tell you the best line of management for your
mm,
fibroids. And if they tell you it's surgery, like I said, it's not all fibroids that must be operated.
mm,
Yeah, if they are seedlings, they're still very tiny. There's no point chasing after them. You could still
mm,
achieve your fertility dreams. There might be other, like I said, you can't say fibroids stops a woman from getting pregnant. Yes, it could impact and prevent pregnancy, but it's not in all cases. You need to evaluate the person as a whole because there could
mm,
be other reasons for getting pregnant. But
mm.
if fibroids needs to be operated, please be open to the counsel you've been given. Fibroid surgery, like any other surgery, it can be very safe. Yes, we know that complications could arise from surgery, but when it's
Yeah.
done by good hands,
Mm,
those complications are really, really minimized. So I just want them to be open to that counsel. There's not no need to be scared. Once you're sure you are in a good place, in trusted hands, you know that your surgery will go on smoothly, and you'll be fine at the end of the day.
And you know why it's also important for you to go to a good place. I was just talking with someone not so long ago, and the person was saying that that was like her third or fourth attempt of attempting a myectomy, that they will try
Yeah,
the first
they'll
time, they are not able
they'll
to
close
get
her
the
up
fibroid, close her up
or bring her back out.
second time
It's when
and
she
all of.
recovers, they tell her, "Madam, sorry, you couldn't get out the
Oh my
fibroids."
goodness.
Still take her in the
Can
second
imagine this
time.
is opening somebody
Surgery
and
up
closing,
the abdomen
opening and closing, and your fibroid is still not
will
being
be
able to be
moved.
taken out.
Yes.
Wow, like that's really a difficult one. So I also, because I know this question will also be in the mind of young ladies. You
Okay.
know, they also feel like when they have a fibroid surgery, for a young lady that is not
Yes.
married and she has fertility, or she has the mindset of I also want to have my children later on.
Okay.
When you tell them, okay, we think you should have a fibroid surgery, and maybe this is someone that has not given birth, they feel like you're tampering with their ability
Due
to
to
get
get pregnant.
pregnant.
Yeah.
Yes.
Yeah. We
So
get that a lot.
for
Yes.
young ladies, if fibroid surgery becomes necessary, does it in any way prevent them from getting pregnant
No, it
later on?
doesn't. That's why once it's done by experienced hands in a good place, it doesn't reduce your fertility potential. It doesn't
Hmm.
reduce your prospect of getting pregnant. I get that a lot. There's someone I know, very, very huge fibroids.
Wow.
She hasn't been pregnant before, recently got married. And that's just her line of thinking. She has not given birth before.
Oh
People will be
no.
hearing she had a surgery. For what?
Hmm.
But those fibroids are in places that will prevent even
Preg-
fertilization, I mean conception,
Conception.
pregnancy from
Wow.
happening.
Hmm.
And then even if you get pregnant, the risk of miscarriage is so high. So what have
Hi.
you achieved at the end of the day? You want
Hmm.
to go through those emotional traumas and
And
everything before
oh,
you
and
now
then
come back
to the
to the
point
starting
of
point
this, and oh
doing, so
goodness.
it doesn't, if it's done by good hands, a fibroid surgery does not reduce your fertility potential.
Okay, so
Yeah.
hope a young lady that is watching this. I've seen someone about 20 that had a fibroid surgery
Mm.
because she had very heavy bleeding,
Yeah.
and at that point, yes, she had known she had fibroid, but they thought they could manage it. But at some
Mm.
point, the bleeding was excessive, so they had to take it out. And then she's doing fine today. She has given birth and all of that. So you see that it doesn't.
It's
If
not a death
all
sentence.
factors tie up together, if
Yeah.
all factors are fine after
Yes.
surgery later on in life
You
where you get
take it,
married,
you take
pregnancy
in,
could
yeah, we
happen.
get,
So
yeah.
except there are underlying
Other
issues,
issues,
which is not
yes.
related likely to the fibroid surgery the person has had. It's been a good time with you, Dr. Deborah. I must say, I
Thank
had a very
you.
good time and it was very impactful. Thank you, dear viewers, for all our dear viewers joining. We see all of you and we appreciate you guys. You guys are doing so well. We cannot start to mention all your names, but we see all of you and we are very happy to see you today. And we're so happy and we keep looking forward to seeing you join us in our live chat. You have your questions, your thoughts, whatever it is that you have, you could drop your message, your questions on the number being displayed on the screen. We'll definitely attend to them appropriately. Better still, you could also book an online consultation just still through the number being displayed on the screen, and you definitely be attended to appropriately. Once again, thank you all, dear viewers, for joining. Have a lovely evening. Bye.